I'm Dr. Tang Hak Chiaw, and from Novena Heart Center. I'm one of the cardiologists here. My main interest is on the heart muscle disease, or we call it cardiomyopathy. And I also see patients who has heart cardiac changes as a result of physical activities. And one of my main job is to differentiate between the heart muscle changes as a result of physical activities from a pathological condition like a cardiomyopathy. So for those above 40 and then suddenly one day they are keen to start on an exercise program, I think the key is to know whether there is any underlying significant heart disease, and in particular we talk about coronary artery disease or disease of the blood vessels of the heart. For those who have not been active, and if they suddenly go for something that is strenuous, the risk of heart attack will be highest when they participate in strenuous activity. They have to start slow, and they may want to screen for underlying coronary artery disease if they have risk factors. So what are the risk factors? Let's say family history of heart attack, has underlying diabetes, hypertension, high cholesterol, or chronic smoking, right? So all these put them at a high risk of coronary artery disease. So it is important for them to know or to rule out underlying significant coronary artery disease before they embark on any kind of regular physical training. The risk of heart attack will become lesser and lesser once they become regular in their physical activities and physical training. Yes, there is such thing called too much of a good thing in exercise. So let us understand what kind of changes the heart will have when we start to do regular physical activities. So it depends on what kind of physical activities a person do. So let's say it is mainly on endurance training, like long distance running or cycling or swimming. So when you do those activities, there will be lots of blood flow through your heart. So in long run, the heart chambers can get dilated. The right side of the heart can get dilated, or the left side, or both sides. And then our heart has upper chamber, which is called atrium, and the lower chamber, which is called ventricle, right? So both atrium and ventricle can get dilatation as well. So all these changes, physiological adaptation, so they are not considered something, a disease or pathology, right? So if I have a history of somebody exercising really a lot and regularly, and if I see the heart is dilated, then I would just say this is physiological adaptation and no further action. But in some patients, especially after 40 years old or 50 years old, when they do regular physical activity for many years, this adaptation, this dilatation of especially the atrium actually predispose them to have a higher chance of getting an abnormal rhythm that is called atrial fibrillation, or in short form AF. AF can occur in many different kind of heart condition, and like those who have hypertension, those who have blockage of the artery, or those with heart valve problem. But in those patients that exercise a lot until their atria get dilated, they are also at a higher risk of getting atrial fibrillation, and atrial fibrillation can give rise to a rhythm that is fast, irregular, and increase the risk of stroke. So that need to be treated. So this is one of the known bad things that may happen in those who exercised a lot. The last advice is get yourself up and moving. It is always important to have regular physical activities because it has been shown by many studies that regular physical activities reduce cardiovascular disease, reduce the risk of getting chronic conditions like hypertension, diabetes, and high cholesterol, and even reduces risk of certain cancer like breast cancer or colon cancer, right? So please go and exercise regularly, but if you have risk factors, please get yourself checked out before participate in any kind of regular intense physical activities. Thank you.